Okay, we are so excited. Thank you guys so much for coming today. Today we have our special guest. But first, let me introduce myself. My name is Ala Khalil, and welcome to the Resource Corner at Epic Therapist. Our special guest for today is a pediatric neurologist, Dr. Tuba Rashid Khan. She's also an author for My Friend Adam, and it is a book about that specializes on teaching neurotypical kids about communication strategies on that you can use with your neurodivergent kid. We're so happy to have you here today. Thank you so much for coming.
Oh, thank you so much for having me, especially on this rainy day. It just shows your passion for your kids to get through this traffic. And it's such an honor to be talking to you. I'm a fan of your advocacy, and I love what you do for our special needs population.
Oh, thank you. We're so blessed that we have amazing families and amazing patients that are working that are hardworking towards their goals. So today our topic is ADHD and autism, and we're going to really focus on talking about the similarities and the differences, and um, and so let's start off with that. So, what are some of the similarities between ADHD and autism?
Yeah. So it's tricky because the first thing a parent notices is my child is not thriving. Something's a bit off. It's not going the same way per some of my friends' kids. And some of the similarities are that other than not thriving in school or let's say at home, there's this kind of sensitivity to behavioral changes, a sensitivity to feeling overwhelmed, right? I mean, when things aren't going well in our lives, especially if you can remember going back to your childhood, we would feel overwhelmed. And in both cases, the kids are having a harder time reacting to their surroundings. And so there is a feeling of being overwhelmed. And then that's what the parent feels. But, at the heart of autism, it's a social communication disorder, right? There's persistent deficits in social communication, social engagement, and social interactions. Whereas for ADHD, the core of it is there's challenges in hyperactivity, impulsivity, and inattention. And so the similarity is the inattention in ADHD can mimic the lack of social responses in autism, or just even minor challenges in nonverbal and verbal interactions if someone is on the spectrum. The other thing is, being overwhelmed, leading to some sort of movements that can be called stereotypies, can sometimes also mimic fidgeting. And fidgeting is something that one can see in ADHD, whereas stereotypies is something you can see in autism. And so, kind of discerning what that movement is, what is triggering those movements. In ADHD, it would be kind of being stimulated by different things. Whereas in autism, sometimes the stereotypies don't need a trigger.
Right. And so I think when we're really looking at that, the nonverbal cues that are presented, the child being checked out and having some of those fidgets, it's hard, early on to decipher. So when do you feel like is a good time to receive an outside evaluation or get an evaluation done?
Yeah. I always tell parents that if there's a question, then you should seek help. If everything is going great, there's never going to be that question. There are pediatricians, there are developmental neurologists, there are psychologists. We are all here to support you. If there's ever a question, I would say reach out to your pediatrician. And then if your pediatrician feels like this is something of an orange to red flag, they're going to refer you to the proper specialist. And it's very important because those first 3 to 5 years are key in development for a child and are key in getting to the right services and help so the child can have the full support as they're starting school in those early years.
Very good. So we talked about the similarities. How about the differences between ADHD and autism?
Yeah. So to really go into the differences, I would love to speak about more about what autism entails and what ADHD entails. Please feel free to interrupt me at any time because this is more about you and your kids, and really versus me speaking could go into one road versus you asking would help me understand what are your key questions that need to be answered. Okay. So autism is persistent developmental deficits in social engagement, communication, and interaction. So what does that really mean? It doesn't mean we want your child to be the most popular in school. We want your child to thrive in understanding non-verbal cues, verbal cues, right? That social emotional reciprocity is a key deficit that happens in autism spectrum disorder. So what does that mean? I'm meeting a lot of you for the first time, right? But I can see a lot of nodding. And what I also see is sustained eye contact. Even with you, there's this subtle like nodding, then I understand that you're understanding it, then I take a pause and then I reevaluate, right?
Mm-hmm.
So this to and fro is reciprocity. When you take it to, let's say, a 2-year-old child, you may be calling them and they'll look at you and they might show you what they want with pointing, and then you're looking at them and then saying, do you want water? And then the child is nodding. What is that? That's a to and fro, right? That understanding that even emotionally, if you're angry, no, right? And of course, we always advocate for patience within our kids, but even that intonation change and no, that eyebrow being raised, that's that understanding of emotional facial expressions that even happens in young kids, yeah. And the second thing is really maintaining relationships, right? So a child who may have high functioning autism may be close to a caretaker, but as they grow older, are they able to maintain it in an age appropriate way? If mom is crying, they understand mom is upset. Are they coming and showing some sort of empathy? Whether it's through parallel play when they're younger or interactive play, understanding imaginative play. So those are all, the key to maintaining relationships. Sometimes when they're older, like 16
Mm-hmm.
years old, understanding sarcasm.
Mm-hmm.
And then picking up on verbal and non-verbal cues, just like I talked about. Any questions up to this point?
Yeah, so a big part of the emotional piece for autistic kids is a lot of times we think that they are not understanding emotions and not feeling the emotions, but the reality is that they don't have the socially appropriate way to communicate it. And so when they have treatment and they start to understand their emotions as they get older, they are able to understand those emotional, they're able to pick up on those emotional cues that they are seeing in their with their social partners. And so they're able to show that emotion and have that connection. So I think one of the biggest things is that early intervention piece is working with providers very closely on identifying that the emotions, identifying their feelings early on, because without that understanding of their emotions as they are developing different skills, they're not going to be able to communicate them. And so it's so important early on, with whether it's a speech therapist, ABA therapist, occupational therapist, you're really working on identifying the emotions, identifying their senses, using all their senses to understand their own self. And so, as they get older, kids that are on the spectrum are able to be very like that emotional piece becomes their strength, and they're able to use it in so many beautiful ways. And as we see, like in our world right now, some people, you might not actually notice that they have autism because they're able to show a lot of their emotions and also pick up on the emotions of their communication partners. So I think my question is, what as kids are getting older, do you what kind of whenever you have a child that has ADHD and a child that has autism, what kind of treatments, if they're not diagnosed, what kind of treatments do you think they should seek?
Yeah.
Oh yeah, go ahead. Yes.
Mhm.
So for us, we didn't think of the parents. What are the extra layers that even the professional they cannot? So if you can elaborate on that and
Yes.
go into the details,
Yeah.
we would be
Yeah.
That's really the key question, right?
Yeah.
So we've had 4 things addressed, and don't let me go till I address all of them, okay? So I'm gonna start with what you said, right? That's the goal of every parent, for their child to reach their full potential. But it's also important to know that it's a spectrum, right? And every child is gonna have their strengths, and we can hope for them to reach this certain idea. But everyone's going to have their own journey. And with therapies, they'll reach their best potential. And sometimes, you know, what we hope for a child is very different from what the child ends up achieving. But that doesn't undermine what the child has achieved, right? And so a diagnosis of whether autism, ADHD means that those deficits and challenges are going to be there more likely for a lifetime. But how do these therapies help support the child in navigating these challenges, right? If the child is high functioning and can achieve going to college because they had early therapies, they still need protection in college, because those challenges will come at each step. And so how do we support them in each transition of their life is something that's important to understand, that even with the best therapies, it doesn't mean the challenges will disappear in adulthood. But how do we navigate, right? We seek jobs for kids when they grow older that helps them navigate, minimizing some social interactions. Maybe I've had patients who are 19, 20 that want to go into art and animation. So that involves, working with the computer and less so with other people. So there's always that roadmap where you have someone where the autistic features may not be discernible, but then you may also have that child who grows up to an adult where it's still a severe challenge. So that was the first part. The second part is, we talked about autism, but if someone is developing appropriately, right, in that they're meeting their developmental milestones, they are able to understand verbal and nonverbal cues, right? And their challenges and deficits have to do either with hyperactivity, right? Always fidgeting, or very regularly kind of being disruptive in class, or when it's inattentive, forgetting things, forgetting homework. And it's not just in one scenario, it has to happen in 2 or more scenarios in their life, whether it's school and home, or let's say a church or a mosque that they go to regularly, and daycare. And so it's not just, in both cases, you see, it's not just one symptom. In both cases, it's a whole myriad of symptoms. And so because each diagnosis is made with multiple symptoms, that's how physicians and medical experts can differentiate between autism and ADHD, right? Autism is going to be this whole challenge in social interactions, right? ADHD is going to be about hyperactivity, impulsivity, and or inattention, right? Depending on which type. But if it's just solely ADHD, there shouldn't be issues in maintaining sustained eye contact. There shouldn't be issues in understanding what pointing means, right? And the thing to also be aware of is autism is very often also seen in the context of having ADHD. I have many patients who have autism and ADHD. And sometimes it's the child coming in because they were hyperactive and the parents then noticing the poor understanding of social cues. And to give an example, and of course, this is just an example, but just saying fire, fire, that intonation will show a child, even if they don't understand what the word fire is, that there's danger in that direction. Versus like, ooh, fire, the young kids, like, oh, this is exciting, right? It's very different. Or don't cross the road, look out. The tone and even the pointing, right? And someone with ADHD and not autism is very likely going to understand that. Whether they have the inattentive type or hyperactive type, that danger is likely going to get their attention. And so, of course, the difficulties arise when it's subtle ADHD and subtle autism, and they both are together. And that's why the importance of psychological testing that is thorough is very important in those cases. Okay. There were any other questions? Yes, you talked about the importance of therapies, but I did talk about a lot right now, so I do want to pause if someone had a question before I talk about therapies.
I have a question.
Yeah.
So, for ADHD, there's a psychological testing for that because for autism, there's psychological testing, and I think my son might have both.
Mm-hmm.
And since he's only 2.5, I know that'll change as he grows older because developmentally, like you're a toddler, so like we won't really know until he's older, verbalize more, understand things more. But I see like pieces of both. Like he has really good eye contact with adults and trusted therapists and stuff. But he has a lot of hyperactivity. Like when he's in his speech sessions, he'll go from toy to toy, or he'll just get fixated on opening and shutting the doors and kind of just like run back and forth. So I think ADHD is also playing a part in it, but I just don't know when to seek out that diagnosis, or because if I get a diagnosis for that, maybe that'll help, seek out more therapy, more targeted therapy.
Yeah, so I like that you pointed out an orange flag that is associated with autism. Yeah. Kids having challenges in social interactions and sustained eye contact with their peers, right? Yeah. And then to answer part A of your question, yes, there is psychological testing available for ADHD. And it's available at the pediatrician's office. It involves some questionnaires that if they're in school, that goes to the teacher, that the parent has to fill out. Then there's other ones that a psychologist can do. The other thing is, there's also clinical judgment, right? What does the physician see in the clinic? And that is just one scenario. What does the parent tell in their history? Sometimes is the banging of the door a sensory issue that's part of autism? Is it they're overwhelmed because their routine has been changed? And is that the banging of the door? Is it they're overwhelmed and they want your attention because they don't know how to communicate it verbally and non-verbally? And is that banging of the door? Or like you said, is it hyperactivity and ADHD? So when, a patient's mom or dad or primary guardian talks to me about this, these are the questions that are important to delineate, right? When do you see this happen? What is the trigger? Is it when he's trying to get your attention, right? And then versus, is it just when he's kind of fidgeting and getting antsy? So those are the kind of questions that kind of, make us differentiated. But like we said, autism and ADHD can be seen together frequently. And that's where psychological testing, seeing your physician regularly, going to a subspecialist will really help. And now that you're seeing concerns for both of them, we know that early intervention is key. And so I definitely advise that you talk to your PCP about this as well. Yeah.
So that's something you can do in children as young as 2, 3.
Yeah, it's difficult because some of the ADHD testing for those psychologists that are tuning in, but I don't want you to remember it, because when you go to the PCP, I don't want you to be fixed on it, right? Because what if the developmental pediatrician thinks, okay, we have to kind of target this, right? Like, what if they feel the banging of the door is more autism? But there's Vanderbilt testing that is kind of in older kids, and you can't do it in the younger age group. And then there's Connor testing, which can be done as like young as 3 years of age. And so it's hard for psychological testing for ADHD in the 2.5-year-old age group. But of course, autism testing can be done, at even as early as like 18 months of age. And I mean, we've had kids in our clinic that have had so severe symptoms that they've been like around 10 to 11 months of age. But that's why I talked about the importance of clinical decision making as well, because I'm not a psychologist at the end of the day, but there's a lot of diagnosis that can happen through thorough observation in clinic by a pediatrician, a neurologist, and a psychologist. So it's not that you should delay seeking out the diagnosis because of what we just discussed. Of course. Any other questions you had? Mm. Yeah. Yeah.
When you had to leave that.
Yeah. So this comes to that you were talking about the therapies, and then we'll talk about the medications.
Okay.
But anything you wanted me to clarify before I went on to the therapy part?
No, I think that's a big question, is like, at what age should medication be considered? And sometimes we see ADHD and autism, that they're not coexisting, but it's so important to emphasize that they do coexist, and getting that treatment medication wise for kids that have autism to early on is also good. But then how early? So you want to also gauge it. So what are your thoughts on that?
Yeah, that's a great question. So that being said, right, no, not every kid is the same. And not every journey is going to be the same. And even though 2 kids may have the same diagnosis, their challenges may be more severe, whereas one might be mild. So for kids on the spectrum, we recommend applied behavioral analysis, right? But there could be also speech deficits and fine motor challenges, and that's where a speech therapist and occupational therapist is important. And then it's like, oh, we're throwing all of this at the parent, and how hard is it to go to your job and take care of your other kids, and then all of that driving thing. So I cannot sit here and not be compassionate and be like, okay, this is needed, this is needed, this is needed, right? And so the dream is to get that one place that can offer everything, right? But for the social interaction part, applied behavioral analysis is what has been most evidence proven to help the challenges that occur with autism, right? And then the thing is, it really requires the parent the physician, the therapist coming together to see what's best for the child. And also, the school plays an important role too, to have a really good, protective, individualized education program and plan in place is so powerful. And I've had patients where they're pretty on the high functioning side, and pretty much on that side, and they don't need 8 hours of ABA therapy a day, and they thrive in interacting in school where there are other kids, but that means they also need a good protective IEP in place. And so then I have patients where they've thrived with a few hours of school. So they go to school in the morning and then they go to ABA therapy or speech therapy in the afternoon. And then I've had kids where they were in ABA therapy and it was needed because they had pretty much severe challenges. And, once they started gaining those skills, they were able to integrate in school. So it really is having to come to what is best for your child. What does the therapist think? What does the psychologist think? What does the doctor think? And what do you think? And we will see it in your child. Your child's improvement will show what's working. In terms of medication, I am not your child's doctor. And so again, it's going to change, right? But what I can say in general is we don't jump to medication straight away, because what is most profound in helping development long term is therapy. And medications have their side effects, but they are important. If I have a patient who has autism and severe behavioral issues where they're a danger to themselves and they're a danger to their siblings at home, and it's not that it's volitional, the child has a hard time, it's overwhelming. So for their safety, they are FDA approved behavioral medications that we can give. And, there's the age where they are FDA approved. And sometimes we have patients where it's the behavioral challenges are so severe that we have to talk to the parent and say, well, they're a bit younger, but this medication has been used for the last 10 years. It has been effective in this number of patients and this percentage, but it comes with this side effects. And you have to weigh the pros and cons. The same thing with ADHD, right? Is there a really good now we're talking ADHD in the setting of autism, then there's an individualized education program. If we're talking about ADHD outside the setting of autism, then there are 504 plans, right? And so is that enough to help the child succeed in school versus they need medications? And medications are not bad if they're helping the child thrive, right? Because that's the end goal, to help this child reach their own best potential. And how can we as a community, parents, medical providers, and teachers and therapists help this child thrive?
Yeah,
Yes.
some parents, I am parent, um, it's not easy for us, and we want to try everything else.
Yes.
And subhanAllah, at some point you said, maybe it's needed, but we want to try other stuff. So, what are the other stuff that you can try before before you say, what, I exhaust all my resources?
Yeah. And so for that question, are you talking about autism, ADHD when they occur together? Could you give a specific example?
If I have to give a piece of ADHD, fine. Till this day, we don't know exactly where he fits, because Alhamdulillah is high functional, and but what I see he has. So especially the verbal thing. Let's say he has a math homework. If it is like 3 or 4, directions, it is very hard for him to picture it to visualize it, so he can solve it.
Yeah.
And when he gets overwhelmed, what are the 2 numbers? He multiply them and that's it, or divide them and that's it. So just to, I feel a little bit, maybe I can, through therapy,
Yeah.
maybe we can do that transition just to teach him or to train him to
Yeah.
get from that stage where it is just words
Yeah.
and, picture it in small pictures and then solve the problem.
Yeah.
Because he is in a general setting,
Yeah.
and in a general setting, he needs to, that is the homework of the
Yeah.
day. He cannot,
Yeah.
he cannot.
Yeah. So my first recommendation is, I'm sure you've already done it, but to continue having those conversations with his doctor, because that continuity in care is really important, where that your physician is able to ascertain, okay, we've tried your child in therapy, and do they need more support in therapy, or do they need a change where they need more support in the educational plan at school? And in terms of medication, is this inattention due to ADHD, or is this inattention because it's a learning challenge, right? Sometimes when a child is not understanding what the teacher is saying, we tend to zone out. So is this a learning challenge that's happening? Do they need extra classes, extra support in maths per se? Or is this inattention that's being perceived because there's still challenges in understanding the social reciprocity? So once that is ascertained, and if it is truly inattention that is severe due to ADHD, along with having a stronger 504 plan versus IEP, they are non-stimulant and stimulant medications that can help with inattention in ADHD specifically. And you and your doctor have to sit down and see what is the best option for your child. And a lot of times, it may not be that that first medication worked, right? So it has to be through trial and error. What one medication may have not caused a certain side effect in one child may cause a side effect in the other child, right? And then it's not dose specific. I mean, we know, okay, this amount of percentage of kids are likely to have this side effect in that high dose, which no doctor starts at a high dose, right? We always start at the smallest, safest dose, and we do it as long as it's beneficial for the child, thriving for the child, where they really continue to thrive without any side effects, right? And sometimes starting a medication, you can have sleepiness in the beginning and not have it like 3 to 5 days later. So that's why really having that close partnership and communication with your doctor is key to deciding if medication is needed, and if so, what. And just being prepared that that first medication may not help, and it may be a trial and error. Yes.
Going back to the therapy, how do you decide, I guess, therapy versus ABA? Is ABA targeted more towards behavior, specific behaviors, or
So yeah,
Go ahead.
no. So I think the most important thing is to identify them together, because behavior is communication. So if a child is having a behavior and they don't have the words to express that they're upset about something, or they're, like they're not able to get their cup of water, so they have a behavior, they're throwing themselves on the floor. You have to look at, okay, my child has this behavior, they want something and they're not able to communicate it. So for us as parents, we're the detectives to try to figure it out. For therapists, our jobs are to give them the tools so they can communicate it in a functional manner. So it's so important to have, like, if a child has extreme behaviors, to have that partnership with the ABA therapist and speech therapist, so they can develop functional communication systems early on. Because what we're seeing is, if a child doesn't have a functional communication system, which the speech therapist evaluates and recommends, then they are not going to be able to use those systems functionally in an ABA center. And if there's not that close connection, then they're going to be they're not going to be able to grow in their communication skills, because ABA therapists aren't communication specialists.
Okay.
So it's so important to have both early on if your child's having those behaviors, because if they don't have a comfortable way and a motivating way to communicate, and they're constantly not feeling like they can express, they're going to lose that motivation and the behaviors are going to increase. So our job is not to take away the behavior. Our job is to help them communicate the behavior in a way that they feel heard. But is there other treatments other than?
Yeah, I mean, that's why close communication between all the child's providers is key. I love it when I have a patient and the mom's on the phone and says, Dr. Rashid Khan, I have my child's ABA therapist on the phone. Oh, I have my child's teacher on the phone. Because we see one thing in clinic, and then it may be very different in school.
Yeah.
And in my experience, and most neurodevelopmental physicians, the ones that end up being referred to us versus the general neurologist, the developmental pediatrician, tends to be the more severe cases where the behavior is such a huge challenge. One may enter the room and the child not even acknowledge that a person has entered. Dropping something on the floor and the child not even turn, even though they've had the hearing screen and they don't have hearing deficits. In that scenario, they go to the speech therapist. They're not going to have that communication skill to hear the speech therapist, even though they don't have a hearing deficit. So then in that scenario, ABA is really the key to help those social skills, where then they can start absorbing what the speech therapist is saying. There's also scenarios where we have moms and dads, especially if they're a single parent. Oh, how I wish I could cure the challenges in life and have this little bus pick up all the kids and the parent go to work and then pick up this one child whose therapy plan is like 3 therapists and here and here and here. And it's sometimes, I mean, not sometimes, most of the times that doesn't happen, right? There is no bus that's going to pick up your child and be like, oh, this occupational therapist, this ABA therapist, this physical therapist, great, let me be your personal driver. And then sometimes there's issue about insurance coverage. And so how do I tell a patient, parent, this is important when there are these challenges? So I have to work with my families, because that's what they are. They are my families. And I am so lucky that I don't have to do this alone. In a lot of places where I've worked, I have this amazing social worker. And you have to see what is covered, what can they afford, what is their transportation availabilities, and how are the most severe challenges affecting this child. And if it's really that one choice and it's severe, then we have to say ABA therapy. But that's the dream, right? If you have someone like Alaz, your therapist, and you have this winning ABA therapist, and that's the dream. But how many people can afford that dream? And that's why this is so important. The more we talk, the more advocacy is transmitted in the internet universe. You guys are strong advocates, and hopefully one day that dream is achieved, where there is that bus that helps parents who are single and working. And even if you're not single, even if you're not working, it's so overwhelming. That to expand those services at an earlier age is just will make the future generations' lives better. It would decrease cost. It would help our wonderful kids integrate into society. And hopefully that happens
Yeah.
in our lifetime.
I know. No, but I think like, just having that mindset of a multidisciplinary approach,
Mhm.
always having a team of providers that you trust, and that connecting them all together, because we all have to work together. The doctor has to be in constant updates with their treatment plan, understanding their growth, so that way they can monitor their whether medication is needed or not. Same thing with the other therapies, having that close connection, the school having a good IEP. That multidisciplinary approach is the key to a child's growth, because it really takes a village to grow and build socially, emotionally communicators. And so I feel like when you look at it that way, it does it the child grows in so many different beautiful ways.
Yeah. And you guys are so strong advocates for your kids, but I really want to emphasize that I don't want you all to feel like, oh, I got to do this for my child. You have to take time and take care of yourself, because this is a lifelong journey.
Yeah.
Your child is going to need your support. Even your typical kids. I mean, my sister and I, we still will call my mom and be like, hey, we need you, you know? And so you have to take care of yourself so you don't burn out. And please do not be hard on yourself. You are giving the love and attention to your child, and that is the most important thing. And even though it may not show in the emotional reciprocity, they feel it. I can see the difference in my patients when there's a supportive caregiver versus not. So thank you so much for your time.
Thank you guys so much. Are there any other questions? Yeah. Yes. Oh, sorry.
No,
Let's see, and then we'll do it on. Yeah.
He wants
Mm-hmm.
let's say go out. We might get ready soon. And as soon as he's ready, he wants to go out. Do not wait for anyone else. Go out. So would it be this ADHD or just autism?
Yeah. So we talked about, it's really important to see the whole child's behaviors, right?
Yes,
Mhm.
yeah. My son is on spectrum.
Mhm.
And he has been diagnosed.
Yeah.
On spectrum. But this impulsive behavior, is it exclusive to
Mhm.
autism, or it is the main sign of or major sign?
Yeah. That second part of your question is the golden ticket question, right? So it's really the same thing, right? Is the impulsivity because he doesn't understand the social cue that we have to wait. We have to wait. Sister hasn't finished putting her shoes on. Sister hasn't finished putting her shoes on. And is it the lack or a mild challenge in understanding the social cue is we wait for everyone to get ready and then we get into the car. Not understanding that dad hasn't reached the door because he's still waiting to get ready, versus understanding the social behaviors that everyone's getting ready, but I'm agitated, I'm fidgety, and I'm impulsive and I want to go out. And that's the difference between an autistic behavior versus an ADHD behavior. And then it gets even more complicated to differentiate, right? Is this both? And with autism, we see a lot of ADHD behaviors because autism is associated with a higher percentage of kids having seizures. Not all kids with autism will have seizures and epilepsy, but some of them can. A lot of them can also have ADHD. So the question is, if your child already has a diagnosis of autism and is already in ABA therapy and the therapies they need, is it helping target this impulsive behavior? Have you talked to your therapist to see if it's helping this impulsive behavior? And if it's not, is the therapist recommending you talk to your physician? And I'm recommending you should always talk to your physician and therapist for any challenging behaviors, right? Any improving behaviors too, because we love hearing when kids are thriving as well. And is this something that needs medication along with therapy? Is this something that now needs psychological testing to see if your child now meets the criteria for an ADHD diagnosis along with autism?
Why 04 plan?
Yeah. So for most kids who are diagnosed with autism, we recommend an individualized education program, which is a higher support than a 504 plan. A 504 plan, a lot of us will not recommend for kids who are on the spectrum. And some of the examples are a teenager that has maybe a mild learning problem like dyslexia. A 504 plan will give them maybe some extra time outside the class to target that challenge, or maybe like a teaching assistant to sit with them and help with that. For someone who has met their social and verbal and physical and fine motor and gross motor milestones on time, so is developing appropriately and just has ADHD, sometimes it could mean just some extra time for the exam. Someone who has autism, that extra time in the exam is not going to help them a lot most of the time. So a 504 plan is not as supportive compared to an IEP plan. And a 504 plan is great for kids who just need that little support. And so talk to your school, have them evaluate a plan for your child, communicate what the plan is with your physician, and then that whole multidisciplinary approach will help support, hopefully, getting the child the best support in school. Did that help answer what a 504 plan is? Basically, it's just less support compared to an IEP. And in some cases, that may be all your child needs. But I have not seen a 504 plan be enough for many of my patients who have been diagnosed with autism.
First time I heard that
Yeah.
sound, I hope so. That's why I'm asking.
Yeah.
They offer here
In public schools,
Mhm.
yeah. And I think the good thing to kind of think about it, it's a fluid plan. So as your child develops, it's constantly changing. So your child might start off with an IEP plan, and as they gain that independence, gain more skills, we're always looking at what is the least restrictive environment. We don't want our children always on an IEP plan because it's very restrictive. They have to be pulled out for a certain amount of time, that there's certain amount of time that needs to be provided, that the child might not necessarily be in the classroom with all their other normally developing peers. And so, kind of looking at your child's needs and having that mindset early on that your child might have an IEP plan, but then as they become in middle school, if they've mastered all their goals, they don't need that much support. Your teachers and your education team might say, okay, now we're it's time for us to transition him to a 504 plan. And don't feel like, oh, they're taking away support. That's part of gaining that independence and giving your child the opportunity to be in the least restrictive environment. So it's always constantly looking, okay, where's my child at? Looking at that multidisciplinary approach, what's going on, and how do we get them to that independence? Because we want them to be independent ultimately, independent communicators. So, is there any more questions? Yeah. Yeah.
Go ahead.
Oh, sorry.
IEPs, they're only offered at public.
Yeah, so they're individualized plans for so you can have a plan in a private school as well, but it'll probably be supported differently. So yeah, so it looks different in public versus private because the private schools might have the school district providing outside providers to come and give that service.
So
But it
whatever's
can be done
At a private school, so I haven't seen it. I honestly have only seen it in one school here in Dallas, and they have a psychologist there, and so it's and they have other providers, like they have a speech therapist in that private school. So if the private school doesn't have the speech therapist and occupational therapist and behavioral resources, they might not be able to implement the individualized plan. So if the private school has those resources, then yes, they can implement it. or they can, if they're zoned in a district, they might be able to get a private, get the public school speech therapist into the private school. But in general, what I've seen, if a school is not supported to work with children like that need specialized intervention, it's going to be hard for them to implement that plan that's developed in the public school.
And are we able to provide an IEP like privately, like maybe getting him out?
So the best resources to answer that is an education specialist, a special education specialist, and um, a social worker, and speaking to the local school district and the school you're thinking about. But I have had patients who, when sometimes transitioning, either something's happening in their family or medically, where they've had significant severe behavioral challenges where it really restricts them to even sit in the car because it's not safe for the parent. And so they have to either go to a medical facility to take care of themselves, or staying at home is kind of what helps calm them down for a temporary amount of time. I've had my social worker work with the local school districts to get the IEP be home schools. So I definitely reaching out to your school, reaching out to the state and seeing what services there are. And we can look at websites where you can get more information on this. But just because of certain things I've seen in my clinic, and my amazing social worker, shout out Miss Donna Bailey, has provided those homeschooled IEPs. I know there is some availability in that.
Rabia, yes.
It is hard to live in a household that they don't have. So why this, explosion increase? That's one. Most likely are in the academia, and the research that you've done recently. Is there is any good news that you can share with us? So probably, other parents, they can be hopeful.
Yeah. It's hard because as a parent, you want everything for your child. And so, what is the good news, right? I know for my mother, it was when my brother said his first word, and it was water. It was like the best day ever. And so, good news is so relative, right? Is good news for someone the cure? And then, is a cure that you lose the personality of the child you've grown to love? Is the good news that your child is now independently thriving? That's the good news for a lot of doctors, right? We want to see the child succeed and be happy. And in terms of medical research, there's so much. In terms of autism, the most evidence proven is applied behavioral analysis. In terms of medication, there's a lot of research going on, but it's not that there's this medication that's going to stop the autistic behaviors. There's one medication that's come out recently, but it's for a specific genetic diagnosis in Rett syndrome. But again, that's for that specific genetic condition. And if something groundbreaking occurs, it's going to be in the news. You're going to hear it from me as a physician if you're my patient, parent. And in terms of your second question, I wonder if it will differ, and the reason is it's a theory, right? And is it because now there's more education and awareness? So kids who would have been missed a few years back are now getting caught and being diagnosed early on. Is that the reason we're seeing increased numbers, or is it truly like a genetic environmental factor where we're seeing increased numbers of autism? And Some of us will say, I think it's a trifecta of those reasons. And some of us will humbly say that unless we see, an evidence-proved research that says this is the reason, then we humbly say no one knows 100%. But I think early diagnosis has definitely been helpful in changing the social situation that we are seeing with less stigma, and hopefully that continues in the diagnosis.
Thank
Yeah,
you
I
so much. Yeah.
also asked the same question. I got the same answer, like not satisfied. But this is related to genetic or like a geographical issue or something like that. But when we are in childhood, we never hear this kind of like word autism or something, just grown up. But now it is very, very, very so many cases now. Why it is like that? It is our food consumption or something. What is the issue?
So this is like a whole hour discussion. I'd love to talk to you more about it, but we know a lot of reasons now what leads to autism that we didn't know before. We know the chemicals in our brain known as neurotransmitters are affected in kids who have autism. We are learning more and more now. There's quite a few genetic conditions that are now associated with autism, which is why when the diagnosis is made, your doctor will say, let's do genetic testing. Will that lead to the answer 100% of the time? No. Is it because our genetic testing, as awesome as it is right now, is still not, where it'll be maybe 20 years from now, which is what I think is going to be a factor, versus we still don't know everything, and we still don't know everything. But we know a lot more than we did a few years ago. We also know certain parts of the brain, the volume is different in kids with autism. And so there are genetic, environmental, neurological reasons for why autism happens. Luckily, we are in a city where lead is not an issue. In countries like Bangladesh, lead is not just associated with autism, lead exposure, but it's associated with neurological other disorders. So I think right now, hopefully we keep on learning things at a faster rate and help our parents, and just give our patients the best that we can.
Thank you so much, Dr. Tuba. Okay, I think we've answered the majority of anything. If you guys have additional questions, we'll have access to, you guys can email me and I'll share your questions and get those answered. And I'm so happy that you guys were able to join today. Thank you guys so much for coming out on a rainy Saturday Saturday morning.
It was a 1 hour, but we took already.
It was 2 hours. Wow. Yeah, there's a lot to cover.
There's so much. It's a whole.
There's so much to learn, and I think this is, the iceberg. It's so important to like think of it this way: is the iceberg of autism is the exterior of those things that we see that are notable, but the underneath layer is that our kids are emotional, social, loving kids that need an environment to grow, and they need providers that are helping guide them to that growth. So always, finding that community is key. Thank you guys so much for coming. And let's enjoy refreshments. We have so much tea from Saifani, and we have coffee from Jack in the Box, and we have bagels. Enjoy.
Yeah. Great questions, everybody.
Oh wow! So we were exactly an hour.
Do you have like a?
Huh?
Do you do like informative Instagram?
No, I am not a social media person like your Miss Ala.
You're right.
I am like
So nice
so out of the social. The only